Okay. It's Chelsea Sandberg. I'm going to be doing the IV insertion video. I am aware that I'm using a dirty chuck, so in real life, of course, I would have a clean one. All right. Prior to entering the room, I would go ahead and look at my orders and see if there's any allergies, check the expiration dates for all my equipment and supplies before I go in, and then go ahead and introduce myself. Hi, Miss Carly, it's Chelsea. How are you? I'm good. I'm good. I'm actually going to be the nurse that's going to be inserting an IV for you. Prior to insertion, I just want to go ahead and double check your name and date of birth. I'm going to go ahead and look at your wristband here. Can you tell me your full name and date of birth, please? Carly Escobar 31XX. Perfect. Do you have any allergies? No. Do you have any allergies to chlorhexidine by chance? No. Okay, great. So what we're going to do is we're going to insert an IV, and this is going to allow us to give you fluids and medication quickly, okay? I'm going to go ahead and first start with making sure I have all my supplies. I have a catheter extender, ChloraPrep IV start kit. I have a 22 gauge catheter IV needle, tape, transparent dressing, tourniquet, label for my IV site, chuck, gloves, sanitizer. Okay, perfect. So I'm going to go ahead and utilize a tourniquet first to just select a vein, okay? All right. Okay. All right. Just looking here. This vein right here looks like a good site, okay? All right. I'm going to go ahead and release that. I'm going to go ahead at this point. I'm going to go ahead and attach my saline. Okay. And then I'm going to loosen the cap here. I'm actually going to take it off, but I need to be very careful not to touch anything inside and keep this piece inside and not touching anything. Okay, wonderful. All right, and I'm going to go ahead and place a chuck under your arm. Okay, I'm going to use some hand sanitizer.
So you could, like, so you're putting it in your vein.
I'm going to grab some gloves here.
Stabilizing. I just pull it out. Oh.
And I'm going to cleanse the site with ChloraPrep. Okay. In real life, I would click this piece to release the cleaning solution or the antiseptic. And I would be cleaning the site in a 2 to 3 inch area around the insertion site for 30 seconds. Okay, letting that dry. I'd go ahead and just grab some tape here.
And don't forget to put your towel on. I think that's only a yes or a no.
Okay. All right. So we are just about good to go. Got everything I need. So now I'm going to go ahead and just apply that tourniquet one more time. Okay. Okay, perfect. All right.
Oh, here. Yeah, that's what I did.
I'm going to grab the needle.
Oh, and then just, so I did.
Putting the cap in sharps. I'm going to go ahead and just inspect the needle really quick and just make sure that there's no issues with the catheter. Going bevel up. Oh, by the way, if the patient did have a reaction to the ChloraPrep, I would utilize alcohol wipes to cleanse the area, but the patient did not have an allergy. Okay, and using non-dominant hand, stabilizing. I'm going to go ahead and insert, bevel up. Perfect, I see a flash. Go ahead and release the tourniquet.
Just make sure that, you use your gauze, apply pressure, pull it out, inspect the catheter's intact,
And then placing my finger, my ring finger right here, I'm going to stabilize the hub. I'm going to now attach. Okay. And to stabilize this, I'm going to aspirate for blood return. Perfect. And then now I'm going to flush the site with 3 milliliters of saline. And I'm inspecting the area to see if there's any swelling. Miss Carly, are you having any pain? No? Okay, perfect. So at this point, I'm just going to clamp this, and I'm going to tape.
How are you doing? I'm doing good, thank you. Okay, so do you have an order
To stabilize the hub.
The doctor ordered to insert an IV on you so that we can give you your electrolytes or any other infusions that he might order.
Okay.
The first
Perfect.
before we do
I'm going to go ahead.
can I verify your name and date of birth, please? Yes, my name is John Smith, 79FF. Oh, okay, John. So that matches your IV and the NAR as well. Before I proceed, I'm gonna do him.
My gosh. All right, so that did not work, but that's okay. I have another one.
And John, do you have any allergies to chlorhexidine or any other type of allergies? No, I don't. Okay. So I'm gonna go ahead and gather my supplies, which I have here with me.
Okay.
I have my IV start kit right here. I have my needle. I have the syringe.
Perfect. Okay. I have a really good seal around that area. Okay. So now I'm going to go ahead and just detach this because it's clamped off.
So I'm gonna apply
And I'm going to tape it.
to your arm. It's gonna be a little tight. It's gonna be for a moment, okay? So I'm gonna go ahead and palpate the vein that I'm gonna be using. Seems like you have a good vein here. So I'm gonna go ahead and clean the area.
Okay. Making sure we keep
And just so you're
the
not
tape away from the dressing.
correct?
All right, I'm just going to put one more piece of tape here.
Okay. So I'm gonna be using the chlorhexidine
Perfect.
solution.
All
And I'm
right.
gonna clean it
Now
up and down motion.
I'm going to go ahead and fill out a label describing the gauge, the date that I inserted it, my initials, and the time. So I would go ahead and I would label that there.
I'm gonna loosen the cap.
Okay. And then I would go ahead, I would document within the system that I inserted the IV with one attempt. Same information in terms of date, time, gauge of needle, the site. So this would be the right lower extremity. And then I would go ahead and document the patient's tolerance to the procedure. Okay? All right. Thank you, Miss Carly. I appreciate your patience. You did really well.